you currently taking Vyvanse in the morning and then noticing in the early afternoon that there's a significant worsening of your symptoms? What you might be experiencing is what people often term the Vyvanse crash. Hi guys, it's Dr. Kid here. I currently work at a clinic that specializes in adult ADHD, and in this video I'm going to give you 4 tips that I give my patients on how to prevent this crash from happening. Tip number 1, add a short-acting dexamphetamine in the afternoon. So one strategy to mitigate this crash is to take a short-acting dexamphetamine just before you notice the crash is about to happen, and this can often smooth the process out for a lot of patients. Now for some patients this crash might come on quite quickly and you don't want to experience this significant crash before you start taking the medication. If you're someone that's been taking Vyvanse for a little while and you can predict exactly when your crash is about to happen, you can often take the dexamphetamine 15 minutes before you know you're about to crash, and this can help smooth the process out for you and avoid having to go through those symptoms. Tip number 2, don't forget to eat. Patients with ADHD, they often forget to do a lot of things, and one of those things sometimes can be actually just eating in general. On top of that, Vyvanse is an appetite suppressant, so sometimes patients don't eat from the time they get up in the morning all the way to the time they experience the crash. This can lead to low blood sugar levels, or hypoglycemia we call in medicine, which can give you symptoms of fatigue, dizziness, mental slowing, poor concentration, and irritability, which often mimic the symptoms of the Vyvanse crash. So it's really important to remember to not skip breakfast, and even if you're really busy, make sure you have something small like a banana to avoid that hypoglycemia in the afternoon. By the way, if you're finding this content helpful, make sure that you like and subscribe to the channel. It will really help me out a lot. Tip number 3, make sure that you get adequate sleep. Now with patients with ADHD, poor sleep is already a very common comorbidity. On top of that, Vyvanse is a stimulant medication, and one of the side effects for some patients is that it affects the ability for them to sleep. Now poor sleep can lead to symptoms of fatigue, poor concentration, and inability to focus, and it can mimic and accentuate a lot of the symptoms of the Vyvanse crash. Now sleep is a big topic and an entire video itself can be dedicated to sleep. However, I want to give you a few tips in this video today so you can start improving your sleep and therefore reduce the risk of getting the Vyvanse crash. So the first thing I would do is avoid all caffeine. Now caffeine is a stimulant and obviously it can affect sleep. On top of that, when it's taken with Vyvanse, both stimulants can actually potentiate the effect of each other and have a greater effect on sleep. Now for some people, it's very difficult to get rid of caffeine completely, and many patients ask, can I at least have one coffee in the morning and no other coffees throughout the day? My answer generally is to try and avoid all caffeine if possible. This is because the half-life of caffeine is 5 hours, meaning the average person takes about 5 hours to clear half the caffeine that's already in their body. It takes approximately 5 half-lives to clear 97% of the caffeine, and if the half-life is 5 hours and it takes 5 half-lives, that's 25 hours to clear 97%. Therefore, depending on how strong your one coffee is, it's very likely there may still be some caffeine in your system by the time you go to sleep. The next sleep tip is to engage regularly in moderate to high intensity exercise. This will make sure that you burn a lot of energy and that you're much more tired at night and more likely to get a more deep sleep. The next step for sleep is to make sure that your sleeping environment is optimal for sleeping. Some of the key variables to control in the bedroom environment is to make sure that there's complete darkness, make sure that there's no distracting noises, and make sure that there's a good room temperature to sleep in. The last sleep tip I'll give is to avoid using your phone before bed. Now, phones emit blue light, which disrupts a chemical in your brain known as melatonin, which is normally released when you sleep at night and helps regulate your sleep pattern or your circadian rhythm. Even if you use the blue light filter function on your phone, it's also the fact that your body doesn't associate the bed with sleep. It associates the bed with getting into bed and scrolling through your phone for 1 or 2 hours, and therefore makes it difficult for people to get to sleep. So this is why I encourage no phone at all if possible. However, if you have to use your phone, what I encourage patients to do is to do this in a different room with the light on, so your body knows that it's time to be awake. And then when you finish, then you go into your bedroom, and then your body will associate your bed with sleep. Now my fourth and final tip to help prevent a Vyvanse crash is to avoid all alcohol and recreational drugs. Alcohol upregulates a chemical in the brain known as the GABA receptors, and this is an inhibitory chemical in the brain. Alcohol is well known, particularly taken excessively, to impair reflexes, concentration, memory, and cognitive function. On top of all of that, alcohol can interfere with the absorption of Vyvanse and therefore increase the risk of a Vyvanse crash. This would be also the same principle for any recreational drugs. So that's why I strongly recommended that all alcohol and recreational drugs is avoided when taking Vyvanse. So to summarize, the 4 things you can do to minimize the risk of a Vyvanse crash is take a short-acting dexamphetamine in the afternoon, make sure that you don't forget to eat in the morning, make sure that you get adequate sleep, and to avoid all alcohol and recreational drugs. So hopefully you found that useful. If you did, make sure that you like and subscribe to the channel, and I'll see you in the next video.